So within my role as a learning disability specialist dietitian, I see people with a learning disability for any nutrition related issue that they might have. So it can range from people who are trying to put on weight, people who are trying to lose weight, people with gastrointestinal issues, maybe celiac disease, people with diabetes, really any nutritional issue that a person might have. I will see them and adapt the dietetic advice and the dietetic information that we need to convey to meet the needs of that person and make sure that the information is accessible in relation to their learning disability. So within my role, I would see people from any community really, so anybody with a learning disability, and I'll work with people with lots of different conditions. All of my patients will have a learning disability, but many of them also have physical disabilities or other complex medical issues as well. So people with learning disabilities face a lot of health inequalities, and a lot of those can have a dietary component. So it's very important to have learning disability specialist dietitians because we have the nutritional knowledge to be able to support people to improve their health by improving their nutrition. But being a learning disability specialist dietitian also means that we understand all of the other factors that can impact on somebody's physical health and mental health and their quality of life as a result of their learning disability. So within my role, I work with a wide variety of different health professionals. So that might be speech and language therapists, physiotherapists, occupational therapists. I'll work with psychologists and psychiatrists, and also the individual's whole support network. So that will be their family members, other medical staff like GPs, for example, and also care staff. So you really get very much embedded in the person's whole life and meet all of the people that support them and help them to live their life. So I work in lots of different settings. I will visit patients in their own home. They might come into clinic. I might see them at their day service or at school or college. So I can see patients in lots of different settings. And often my day is dictated by what's going to suit the patient best. Yeah, I'd absolutely encourage anybody to work in the area of learning disability, whether that's as a dietitian or in another role. I find it an incredibly rewarding job, and you really work as an advocate for the patients. Lots of our patients would really struggle to advocate for themselves. Many of them have communication difficulties, or they may not be able to identify the problems that they're facing themselves and independently seek help to address those issues. Also, as part of the role, you get to work with such great people. People working in learning disabilities are very passionate about their work. I find that they're very supportive and kind, friendly teams, and you'll be very supported working in your role in learning disability.